Nearly 1 in 5 Americans were living with mental illness before the pandemic, according to the National Institute of Mental Health. And for many of those people, the coronavirus has compounded their problems. More specifically, people who are schizophrenic are nearly 3 times more likely to die from the virus. That is according to research released earlier this year from New York University's Grossman School of Medicine. That makes schizophrenia the second highest risk factor of dying from COVID-19 behind age. For more on this, let's bring in Dr. Cyrus. She is a psychiatrist and assistant professor of psychiatry at Johns Hopkins School of Medicine. Dr. Cyrus, welcome and thanks so much for being with us. You know, when I read that statistic and I took a look at that report, I thought it was really eye-opening. It's something we really haven't heard that much about. But why are people living with schizophrenia more likely to die from COVID-19?
Right. So first of all, this is a topic that not many people cover, as you mentioned, which is one of the reasons why we don't know exactly why people with schizophrenia might be have the second highest risk in terms of mortality. But some of the reasons that they've identified might be a genetic link that they haven't necessarily found out that might increase the likelihood of getting sick from a virus like COVID-19. That's one thing that's been hypothesized. But most people have been talking about access to services, which we know have decreased during the COVID-19 pandemic. You know, usually a lot of my patients who are in this community have mental health professionals. They have, aides who take them out during the day to go do activities. So you can imagine that social isolation might actually be negatively contributing to their ability to take care of themselves or even tolerate isolation. And I'll also say 60% of folks with schizophrenia generally smoke cigarettes, which we know can increase the progression of COVID-19 infection and your outcomes.
Interesting. Well, more broadly, Doctor, how has the pandemic worsened pre-existing mental health issues?
Yeah, I think one thing that we've been seeing is the lack of access and the lack of mental health professionals. You know, I was reading a study that said that 75% of counties don't have a psychiatrist or enough mental health providers. So the first thing I'll say is that the number of people who are emailing me and my colleagues, and this is actually reflected in the data as well, is that there's definitely a higher need for mental health professionals right now. I think we're also seeing that loss of job, also worry about health and deaths from COVID-19 of family members, and also taking care of your children have been linked to increases in anxiety and depression, which have worsened during the COVID-19 pandemic. So there's so many factors that were happening before the pandemic that are also contributing. And then everything else that we're seeing with the pandemic as it draws on is also contributing. And I think there's one more factor I really like to highlight, and that's a loss of control or sort of certainty over your future, which so many low-income workers and also folks in Black and Brown communities experience just day to day, which definitely contributes to a worsening in mental health.
Yeah, and you mostly work with patients of color as well as patients who are a part of the LGBTQ community. An analysis from the Kaiser Foundation shows 74% of LGBTQ people say the pandemic has had a negative impact on their mental health. Doctor, what are some reasons for these numbers and what are some coping strategies?
Right. So again, it's hard to say what's directly contributing to those numbers. But I think the first thing I would look at is just the prevalence of mental illness in general among this population. And we do know that there are generally higher rates of substance abuse, anxiety, and depression that occur in many of the LGBTQ identities in the spectrum. I think there's also research, which I find interesting from the Trevor Project, indicating, at least among LGBTQ youth, that 80% found that their homes were not currently LGBTQ affirming, which is a really interesting finding, which is suggesting that maybe the isolation and having to not go to school or not being able to go to work or see people who help to affirm who you are might be contributing. So I think what's happening with the youth and the LGBTQ population is particularly interesting. But I think it has a lot to do with environment and people not being able to access some of their normal coping strategies, which then makes whatever would have been pre-existing mental illness even worse when you can't go out and do the things that keep you mentally healthy.
I'm wondering, Doctor, if just for a moment you can talk about this idea of affirming, especially LGBTQ youth, the effect that that has when that does exist in a home setting, for instance, where a young person is in fact given support, is in fact given that kind of sense of being affirmed for who they are.
Right, exactly. So if you think about the pandemic, especially for youth and youth of color, and not being able to go to school or go to work or see your friends from school or people who affirm who you are, but instead being trapped in an environment which may have a house over your head and may have food on your table, where your parents or family members or others may not call you by the pronouns that you prefer, or may not acknowledge the fact that you like someone of the same gender. So you can imagine how these might build up day after day after day, and not being able to feel safe that you can be yourself or even express these parts of yourself, and perhaps having to hide and do this in secrecy. And I think, why I like to talk about this as it pertains to youth is that we are now seeing, especially in youth of color, higher suicide rates than we normally would necessarily see. So I think right now, Native and Indigenous youth have about a 31% rate of suicide attempts, and then Black youth about 21%. And so I like to paint a picture of what this might actually look like for folks who are trapped in these environments where they are not getting the needs and being able to pursue the coping mechanisms that generally keep them afloat. And that's a little bit about what it might look like.
Yeah, those statistics that you cited, really have been alarming to see over the course of this pandemic. So as we reported earlier, several cities saw a dramatic increase in gun violence this Memorial Day weekend compared to last year's. Police worry that the country could be facing an epidemic of gun violence following a year of lockdowns. Dr. Cyrus, how might social isolation and violence be linked?
Yeah, so one thing I want to make very clear is that mental illness does not lead to being more violent. So in general, we do know that folks who are diagnosed with a mental illness tend to be the victims of gun violence. So now, sort of shifting to social isolation, I think in terms of looking at what factors are predictors of violence, we know that being a victim of violence, physical or sexual, also gender, typically young males, is what we see, but then also substance abuse. So these are factors that we've shown are predictors of perpetration against violence. So when I'm thinking about gun violence, I'm thinking about how many of these different factors are present. And maybe the ones that we can try to control would be this trauma area. Think about how many people right now, in terms of the social isolation, in terms of the job loss, in terms of death in families, how that trauma has been agitated and aggravated by everything that's going on with the pandemic. And I think that's the way to focus in terms of thinking about what we can do to prevent whatever epidemic might be on the rise of gun violence as a result of the traumas that have occurred during the pandemic.
Yeah, so many challenges that the society is facing right now. Dr. Callie Cyrus, thank you so much for sharing your expertise with us. We really appreciate it.
Thanks for having me.